How have CFS diagnostic criteria and tests evolved? How have the diagnostic criteria and tests for myalgic encephalomyelitis and chronic fatigue syndrome evolved over time? This question opens a fascinating discussion about how our understanding of this complex condition has changed. In the early to mid-20th century, conditions resembling what we now call CFS were described using various names. Terms like neurasthenia and atypical poliomyelitis were common, reflecting a limited understanding of the illness. It wasn't until the 1980s that formal case definitions emerged. In 1986, myalgic encephalomyelitis was defined, followed by the definition of chronic fatigue syndrome in 1988. These early definitions focused mainly on prolonged fatigue and associated symptoms, but lacked the specificity needed for effective diagnosis and research. As time progressed, the need for more precise diagnostic criteria became clear. A significant turning point occurred in 2015 when the Institute of Medicine, now known as the National Academy of Medicine, published a groundbreaking report. This report proposed new diagnostic criteria that focused on a smaller set of hallmark symptoms unique to CFS. One of the most important changes was the emphasis on post-exertional malaise, which is the worsening of symptoms following physical or mental exertion. This shift marked a departure from earlier criteria that broadly defined fatigue. The report also suggested renaming the illness to systemic exertion intolerance disease. While this name did not gain widespread acceptance, it highlighted the core features of the condition. Following this, the U.S. Centers for Disease Control and Prevention adopted the new criteria, emphasizing post-exertional malaise, cognitive impairment, and orthostatic intolerance, alongside fatigue and unrefreshing sleep. In the United Kingdom, the National Institute for Health and Care Excellence updated its guidelines in 2021 to reflect these more specific criteria, focusing on symptom clusters rather than just fatigue. When it comes to diagnostic testing, there is currently no definitive laboratory test for CFS. Diagnosis is primarily clinical, meaning healthcare providers rule out other conditions that can cause similar symptoms. These conditions may include thyroid disorders, sleep apnea, and autoimmune diseases. The tests conducted are mainly to exclude these other potential causes rather than to confirm CFS itself. Research has looked into possible biomarkers for CFS, but as of now, no reproducible viral or molecular markers have been validated for diagnosis. The evolution of diagnostic criteria for CFS reflects a shift toward more precise, symptom-based definitions. This change improves patient identification, enhances research quality, and supports better clinical care. The recognition of post-exertional malaise as a central feature of CFS distinguishes it from other fatigue-related conditions. It is also important to periodically reevaluate patients to monitor symptom progression and adjust management accordingly. In summary, the journey of CFS diagnostic criteria has moved from broad definitions to more focused criteria that emphasize specific symptoms, while also highlighting the importance of ruling out other conditions through testing. This evolution has made diagnosing CFS more accurate and meaningful for both patients and healthcare providers.